You're now watching The Wash Daily. Today news, Oregon's marijuana companies who have been affected by the Oregon wildfires are not going to get federal funds designed to help businesses who have been affected by the wildfires. The reason is because they're cannabis companies, and cannabis is federally illegal. Their efforts as a cannabis business result in tax being collected by the federal government, despite their hypocritical point of view that those folks can't apply for any assistance because they're a cannabis business. Last month, Oregon saw $106 million in cannabis sales. The third month in a row, they've exceeded $100 million. Pretty crazy that they can't get any relief. The state's shooting themselves in the foot. They need to make those funds available. Also in news, a subgroup of the FDA Women, they're looking at the effects of CBD and they're hosting a series of meetings in November. The meetings are designed to help study CBD specifically in women and how it affects them and how it helps them. They wanted to discuss biological and psychosocial differences between men and women regarding the use of cannabis and specifically CBD. CBD has been a huge deal. The CBD beverage and cannabis beverage market is supposed to hit $3 trillion by the next 4 years. So there's a lot going on with cannabis and CBD, and now the medical community is looking to study it to pretend they haven't been squandering this information for the past 100 years. Also in news, the FDA is now also making policy changes to make it quicker and easier around CBD-based drugs. What they're saying is they're looking to streamline the process to make it faster for orally administered CBD drugs. One of the drugs recently that came out like this is a pedialyx. It's a cannabis-derived product which is shown to help people who are having seizures. Now, the real truth is, without the THC, it's not as effective as it would be otherwise. Charlotte Fiji passed away, but she's probably the most well-known child CBD patient. She was a girl with epilepsy, and she had several seizures. Until CBD seed company Charlotte's Web started giving her cannabis, actual cannabis, not just pills from the pharmacy. She was actually getting actual cannabis, a tincture or something probably. All you can say is that they're purposefully holding back cannabis research for some reason, whatever that reason might be. There's a lot of people who are trying to help their child with epilepsy, and CBD seems to be exactly the thing. Well, the FDA is probably worried that people are going to stop using pharmaceuticals, force the FDA to start actually looking at cannabis and introduce some CBD products into the marketplace. Thanks for watching The Wash Daily.